Welcome back to another episode of the Digital Health Podcast. My name is Anthony Virgo, and I spent the last 7 years at a health tech startup, but now I've created my own AI automation and marketing company along with my partner, Khizar. Khizar, go ahead and introduce yourself. We have an amazing guest that's going to join us today, so I'm hyped for the conversation, and I'm hyped for you guys to listen to our story. So, Khizar, go ahead and introduce yourself to the podcast.
Hello everyone, my name is Khizar and I have been working in the healthcare domain for quite a while. I started with the dental practices, and then when we collaborated together, we started our own AI agency and marketing agency, and we also started our digital health podcast. And now we are working with a lot of healthcare professionals in the states. We are working with psychotherapists, psychologists, dentists, cardiologists, and a lot of other healthcare professionals. So this is a brief introduction about us. Now I want to kick it over to our amazing guest.
So, hi, viewers and Anthony and Khazar. I am Adriana. I am from Romania and I'm a Adlerian psychotherapist with over 11 years of experience. I've started this job by passion and I'm continuing with passion to follow my callings to say. And I put a lot of hard work into it and a lot of thinking. And I saw your podcast and I like it. And because I'm interested on how we can use telehealth and how we can use AI to help us, not just to go with the flow. So I think in psychotherapy, we have this need to learn to integrate all the new things into our practice.
1000%. And I think that's the goal, right, with this new technology is for people to be integrated. But you said something amazing that you started, your journey off passion, which is amazing to hear. We would love for you to share a little bit about, how did you become passionate, about, either you went through something yourself or you grew up and said, hey, this is something that I wanted to change. There's so many people in the healthcare industry that knew that they wanted to do healthcare from a young age. And then there's so many people who kind of was doing something else and then came into healthcare. So we just wanted to know, where did that passion come from? Where did it start? How did you decide that healthcare or just caring for others, performing some type of service was something that you wanted to do?
I didn't have this passion since I was a child, but I always had this way of getting into conversations with people. Even now, if I go into a cafe or if I ride the bus, I end up having conversations with people and communicating. But this did not lead me at first to this job. At first, I studied 1 year in university to become an engineer, so I was very
Oh,
far
wow.
from it. Yeah, because part of my family is in that area, and I wasn't too sure what I'm going to follow in life. And one day I went to a class in psychology university with one of my friends, and I came home and I said, "Oh my God, I love this. This is what I want to do. This is my job." And so I quit engineering and started psychology university. Right after that, sort of life took me step by step and found the Adlerian psychotherapy school, which I profoundly resonate to the day with the Adlerian ways of working with people and seeing people as whole, seeing encouragement, helping people and discover their strengths. So I'm still working in this way and passionate about it, combining with other techniques. So this job, this path found me. I didn't find it first, yes.
Amazing, amazing, and that's an amazing story too. That right, this path found you in some way, shape, or form. Right, you were able to naturally have this talent of communicating with people, or people saw that you were just so it was just so open to open up and talk to you, and and led you down this road, which is amazing because that's what I feel like makes a good, whether it's a therapist or a primary care doctor or a dentist, right, or a coach or a trainer. It's that ability to be open and like talk to them and things of that nature. So how do you pretty much service a lot of your people? Are you working in a private practice? Do you work in a large system? Are you seeing people in person or is it telehealth mostly? What is your day to day like?
So I started working in in hospitals, in cancer patients at first, psychiatry department. Then I started my own practice, at which I still work in. I do face-to-face therapy here in my hometown, seeing clients, and I also do telehealth because I started doing telehealth in COVID pandemic.
Right.
The market of psychologists here in my country was a bit not sure to start telehealth. Things were under discussion that it might not be so good. The connection would not be so good between us and clients. This was just at the beginning of the year 2020.
Right.
And very fast, pandemic came upon us and people were anxious, people were depressed, people were worried, and people also were alone, yes. Everybody was in their houses. Nobody could have come to the practice. So then I started working online, and I also started a collaboration with employee assistance programs. So here I offer counseling, short-term therapy for people from different companies. Mostly I work now with adults, but in my past I have a lot of years that I worked with families and children. Now I have a few children, but they are not the majority of my clients. Families also, and I'm coming upon different situations where even if we want it or not, i.e. it's entering our lives, the lives of youngsters, the lives of children, and therapy, somebody comes to therapy already saying, I searched on ChatGPT and ChatGPT says that. I have that one client that always has, ChatGPT told me that and that and that. So I see there is no working around it, okay? So we must find a way to make it safe, to make it confidential, and to make it a resourceful tool for us.
1,000%. And I think that's the goal, right? Is to make it as a resource, a tool. It's not something that's gonna take over everything, right? We still need humans to sign off on things or have empathy, right? But I guess my question would be, are you finding people are more open in person or on the virtual sessions with you, or does it just matter on the person itself? Like, do you find it that younger people are more so on the remote and using AI, or older people are more so in person, or it just really doesn't matter? It really just depends on the service that you're providing to the patient at that point.
I found by experience that for very young children, telehealth and online doesn't work as good because face-to-face you can have drawings, you can have painting, and a lot of other techniques that are very appealing to young children. But sort to say from 10 years above, I had pretty good experience and managed also to use art therapy with them online because that was the situations. With the grown-ups, it's very helpful. I sometimes have clients that I see here in the practice. So we do face-to-face and I don't know, they go to a hard time at work or they are very busy or they say, come on, can we do the session online today? I do not have that hour to find the parking space or I can squeeze you into my lunch break. So it's starting to be a benefit for us. Okay. We are using this to manage to do our therapy, to do our counseling and not take so much burden out of our day with doing this. Yes, it's supposed to be relaxing and it's supposed to be something that we are doing for ourselves, not just another thing on our schedule and another run from here to there.
Right.
Adriana, now I want to shift our conversation towards the technology aspect. Like, what's the general discussion of AI, of technology regarding psychiatry in Romania? Like, are the healthcare practices readily accepting the new technology AI, or how they are reacting towards the new technology?
I think the market here is divided. So we are just starting. We are having a big congress with brain mapping and all these new technologies that help psychiatrists, help neurology, and help us psychotherapists. So, but we are very at the beginning. We are still having doctors that are very, I don't know, old school, so to say. I think the major thing that will help not only us in Romania, but in general will be that things are more organized, things would be confidential, put in one place for psychotherapist, for psychiatrists, but also for the client, yes? To have a structure, to have a place where you can go and know it's safe, to start working with maybe a therapist or maybe a team of multidisciplinary people, yes, from all sorts of backgrounds. I recently, just yesterday, got a client that needs to, after operations, needs to see psychiatrist, psychotherapist, neurologist, heart doctor, and so on and so forth, because it's more comorbidities relate to psychology, and one thing leads to another. And if we work separately, the result is not going to be so good if it's divided, yes? So it's better to have a collaboration. And I think this would help also in hospitals or private practice to have a place where you can put all things together. And I think here IE will be very resourceful to keep things together in a confidential way, but to help people collaborate and have the information from every one of us, okay? So we can make a plan that best suits the client.
And what's your personal thought, by the way, regarding AI, regarding technology? Are you also using AI or stuff like this in your own practice?
Oh, for now, very little. So I'm maybe using AI to help me find different articles, different studies on neurology, or things that are not in my plate, but I want to look in to see maybe if I have a client that has a certain diagnosis, I will study that. And for this, I find it very resourceful. Okay, it can find things faster, way faster than if I start to go on Google or books and go chapter by chapter and find myself the information I want. So for this, it works good. The part where is not so helpful is the part where just like, I don't know, is it 7 or 10 years ago, when all of us, when we had something, we had a doctor's appointment and we started to look on Google, what is this? And the list came up, okay? So this is the case with the AI now. You search for something and you get everything. So if you cannot get your right information from there, you can, I don't know, get even anxiety from all of that, think you have it all. Yes, you get into the medical student syndrome, when you read everything, you have everything when you learn about what's there. And this kind of sometimes messes up with the process. So we have to drag from there the information and see.
And do you
with
guys
clients.
also have electronic health record, HIPAA, or patient health information or stuff like this in Romania?
Electronic
health record or HIPAA compliant or patient health information, just like in the States. Do you guys also have healthcare system like this in Romania? Or how does the confidentiality of the patient information works in Romania?
We do have this, but psychologists and psychotherapists do not have access to it. We can have access to it only by the family doctor, that everybody has assigned a family doctor. So we can do a collaboration with that person, or psychiatrist, or a hospital, and then we have that information. But it's not a public system. Not everybody can access those informations. Yes.
Got it. Okay, so because I know for us in New York or in the States, it varies. It varies state to state. Even in New York, like, so if you go to New York or California, a lot of our health records are a little bit different. Some people use a different platform and stuff like that. So sometimes it's hard to get records everywhere, or there's places where it's a lot easier where everyone's on the same system. So it kind of sounds similar to how it is in New York, where certain people have access to it, and there's a process to get access. I guess that was like my day-to-day. I was making sure providers got credentialed on like EHR systems and stuff like that. Now going back to the AI stuff, and you working with your client, because earlier you said something about kids actually liking the in-person more than the remote, or they're more receptive, right? And I was at a healthcare like a meetup conference in New York, and it's funny that you say that, because we were speaking with a lot of interns who were like interning for like a large health systems and stuff like that. And they said almost the same thing in terms of like working. They don't want to work from home. They don't want to work on the computer. They actually want to go into the office and, see people and touch people and stuff like that. And I thought that was so weird. I was like, wow, you have a whole bunch of people on this end that, love the remote. We were going into the office for years, and remote and technology had made things a lot more free, right? We talk about work-life balance and stuff on this side, but on that side, they want to go into the office and be around people and, touch and feel humans. I thought that was funny. Yeah, yeah.
Yes, yes. I'm also working with smaller children. I said you win them over face to face is totally different, but also yes, teens like connection. Human connection is human connection. We thrive in numbers. We like to communicate and be around people. But I had good experience also with online. I see that the job gets done. So your intuition is good, because these were the worries that I was hearing from my colleagues. Okay, but you cannot gonna feel the person. You're not going to have your intuition. You're not going to have to resonate with the other, but you can manage to do that.
Hmm.
And I'm doing multicultural therapy, so I work with people from Europe, Middle East, Asia, South Africa. So very, very different scenario from case to case.
All right.
Yes, and I didn't see any problem yet.
Right, right. And I think
Even with you.
it's just the ability to adapt, right? Because earlier you were saying like telehealth, we weren't even thinking the same way. Like I wasn't even thinking telehealth was gonna be. I was like, there's no way people are gonna see their doctors through a computer. It's not gonna work. And then it's like we adapted to the point to where it works really effectively. It's quicker. It lets people be more present. They don't have to sit in traffic or get in their car, or if it's a storm, right? If it's a storm, they want to miss their miss their
Yeah.
appointment or miss their therapy. Now technology has changed that. And we feel the same way about AI. We feel like we're gonna adapt to AI in a way that we're using it almost on a normal day to day, that we don't even think about it anymore. A lot of what we support people with is like 24-hour AI receptionist. Just so like a patient or private practice. So if a private practice might be overwhelmed, or they might have to close for the day or after hours, they still have something on the phone, an agent on the phone that's able to book the appointments, reschedule appointments, do insurance verification, right? Don't necessarily need a person for that, but someone will be able to set that up for to support the patients, and the patients will still be able to get served in some way, shape, or form. And then also just we help train providers, right? We help train clinicians adapt AI, because we know that AI is fresh and new and it's always changing. So we always like to say, hey, this is something that you got to continuously learn about. So if you're learning, you're ultimately going to get better than anyone who's not learning. So we want to partner with people who are actively wanting to learn AI, who's excited about it, and see it as a benefit to healthcare for sure.
Yes, I had my interest here also in this market of AI. I saw job ads on LinkedIn for people in psychology to train AI. So I
Mhm.
joined just two interviews, but here I got more worried than with this information, because you were asked to take a short interview, which for
Mhm.
me just seemed like gathering of information from a lot of people, not
Right.
leading to the job, not leading to the person. So for it to be a resourceful tool, for it to serve us well and to be in our benefit, I think AI should have a lot of boundaries, confidentiality, ethics. For now, it's like a toddler running around everywhere. Okay,
Right.
so yeah, it certainly needs boundaries and confidentiality. And for here, I'm doing my part the best way I can with my clients, and especially with families that have bigger kids or teenagers, and just teaching them about how screen times affect our even grown-ups brains, but also
Right.
children, because many come with the kid, I don't know what's with him, he doesn't pay attention anymore, but he plays games for, I don't know, hours, lack of sleep,
Right.
the eating is disastrous. And I think things go hand in hand. We have to have education on how to use it, and it starts with the older generations, because they are bringing up their children to be responsible and to use it as a tool. Do not replace your life with it. Okay, you still need to go out in the rain or in the
Right.
sun, still need to go through the forest, have human friends, pet friends. Why not? So it's not here to replace the life. This is my way of seeing things. Yes, it will be great for us. It will be a great help if we manage to use it like we used to use every part of changement in movement in history. Okay, when industrial things came, we didn't know for sure what to do. So
Right.
I think this is the place where we are, and feeling pretty optimistic about it. But I think we must pay attention to it and take care of it, that so our kids maybe and the younger generations will benefit from it as a good thing and a resource, not the other horrific stories you hear about it.
Right. Right. All the crazy stories. And is right. It's exactly what you said. It's gonna take for us to, put up the guardrails and, teach people how to be, how to protect themselves with AI or governance or make sure there's no risk. I think there's a lot of moving parts. And the thing about AI, we always tell our clients is work with someone who has the expertise in your niche or is in your domain to support your AI needs. So for example, Khizar and I are in the healthcare field of doing AI because we come from the healthcare background and we're doing AI versus we're doing AI and we have no healthcare background. So we wouldn't know anything about, right, protecting information or HIPAA or, you know what I mean, all the patient sensitivity stuff. We know about that, so we know how to build AI or agents around that stuff versus a lot of companies are hiring people who don't know about this stuff and it's taking longer. It's not really doing a return on investment for people. And a lot of AI tools aren't being implemented where it's supporting the patient as much. It's more so supporting a system. But if we build something that supports patient or patient engagement, then there's a lot more value for sure, which is why we do like a lot of the voice AI agents and stuff like that. So this has been an amazing conversation. I'm gonna be honest with you. This has been super fruitful and we love you for your time. Two last questions for you. One is, what's the best contact or channels for people to reach out to you? So if it's LinkedIn or Instagram or TikTok, how can people reach out to you if they had a question about anything you said? And then also, what's one powerful message you want to leave with the listeners? So anything we talked about today or anything from your personal experience, just let our listeners know one powerful message.
Okay, thank you so much, Anthony. So everybody can reach me on my LinkedIn. So it's Narita Adriana Maria. It's Narita, right, in Romanian, but it's harder for people to get that, the spelling. And my message is I'm very optimistic we are going to figure this out, and let us thrive on being human and being a whole like we were every time, and being together, and things are going to be especially good and optimistic in the future also.
Love it, love it. You have to be optimistic in this world of new technology and stuff like that. So we appreciate you for your time, for being on the podcast and really just being super impactful with us. Can't wait to have a part 2 with you and talk a little bit more
Awesome.
about, AI and stuff and how it's changing Romania. But thank you so much.
Thank you so much, Anthony. Thank you, Khazar.